Hi, David Bryden with Results. I'm the TB Advocacy Officer commemorating World TB Day, and it's fantastic to be here in the Corcoran Gallery honoring TB champions in Congress from research from CDC. And the best part for me is we're honoring also TB survivors who have come forward to lend their voice and calling for action on TB. We're honored also to have with us one of the physicians that treated our TB survivor, Jake Kaufman, who we've also heard from on the broadcast tonight. Dr. Felice Adler, it's great to have you here with us from Southern California. You treated Jake Kaufman. I know it must have been a difficult outbreak to go through, answer parents' questions, and deal with the fact that you had a regimen, you had a treatment that was really not optimal in terms of helping patients get through this process, but you persevered. What was that experience like for you as a physician?
Well, first, thank you for having me here. It was a frustrating experience for both the parents as well as the physicians involved, knowing that you have children who are infected with a serious organism like multi-drug resistant tuberculosis, and knowing that the risks for disease are relatively high and the costs, personal costs, physical costs, emotional costs of having that disease are so high, we really felt like it was important to try and prevent infection. Unfortunately, as of now, there's no formal guidelines or recommendations on how to treat multi-drug resistant TB infections, particularly in children. And this was a source of frustration because we could not give the families any reassurances that the medicines we were giving them maybe making them sick, were not necessarily going to help eradicate their infection or prevent the progression to disease. Clearly, a lot more research and work needs to be done in figuring out which antimicrobial regimens are going to be best to eradicate TB and MDR-TB infections, particularly with respect to children, which ones are going to do so in the shortest amount of time and with the least side effects.
And as you see in California, have you seen TB being a problem among children?
So while TB rates are declining modestly in the country, in California we've actually seen a rise in TB in children who are 4 years of age and under. So while there are pockets of TB that are decreasing, that's certainly not true of every population. And TB can take its greatest toll on children, especially those under 5 years of age. Children who are under 5 years of age who become infected with TB are more likely to develop tuberculosis disease and more likely to develop it more quickly than adults. They're also more likely to develop the most severe manifestations of TB, such as miliary disease, where it's spread all over the body, or meningitis, which can be devastating. They're also more likely to die of their disease.
And if you can make one recommendation, what one thing do you think the world needs to do on this? If you had a chance to talk to the U.S. government, I know you've been visiting with the U.S. Congress this week. If you had a message for pharmaceutical companies, what would that be?
So overall message, both to pharmaceutical companies as well as governments, we need to raise awareness about the issue of TB. We need to remove the stigma of TB, and we need to increase funding for development of new drugs to treat the disease, as well as hopefully in the future a vaccine.
Wonderful. Thank you so much for lending your voice with us this week and helping us honor our TB champions and call for greater action on TB.